Hello, Ms. Black.
Hello.
My name is Dr. Jennifer Reynolds. I'm the physician in the office today.
Oh, good to hear from you.
Okay. Here to help you with your grandson?
Yes, my grandson. He's burning up.
Okay. What's his name?
His name is Michael.
Okay. And how old is he?
He's 6 months old.
Okay. And what do you mean by he's burning up?
I took his temperature this morning. He's got a fever. He's very hot.
Okay. And can you tell me what the temperature was?
It's over 101. It's 101 something.
Okay, it's 101 something.
Mm-hmm.
Okay. And did you take his temperature orally or rectally?
In the ear with that thingamajiggy that she has.
Okay, you took it in his ear. Okay. I want to ask you a couple of questions about Michael. Is that okay?
That's fine.
Are you his legal guardian?
Yes, I am. I have parental rights. His mother dropped him off here several months ago.
Okay. Does Michael have a runny nose?
Yes, he does.
Okay. Is he pulling at his ear?
Yes.
Okay. Does he have anything coming out of his ear?
Yes, he has little discharge.
Okay. Is Michael coughing?
Yes, he is.
Okay. Is he having a difficult time breathing?
Yes, I would say he is.
Okay. Is he breathing quickly?
He's breathing very, very quickly. His muscles hurt.
Okay. So it seems like he's using his body to breathe.
Mm-hmm.
Okay. Is he having a hard time swallowing?
I don't know. He hasn't eaten anything since yesterday. He's refusing to drink from his bottle.
Okay. Does he have a rash anywhere?
He does have a diaper rash, yes.
Okay. And how long has he had that rash?
A day.
1 day? Okay. Is he vomiting?
He spit up once, but it was clear. It was more like water.
Okay, he spit up. It was like water. Okay. Has he had any changes with his bowel movements?
He has diarrhea. Lots of diarrhea.
Okay. How long has he had diarrhea?
A couple days.
Okay, 2 days. And about how many diapers a day are you using?
About 3 or 4 at least.
Okay. Are there any changes with his urination?
No. Just no, not really. I mean, same normal number of diapers.
Okay. Is there any blood in his diarrhea? In the diarrhea, is there any blood in the stool?
No, that's what I noticed.
Okay. Is he shaking at all?
He's got the chills.
Okay. All right. How does he look? Does he look tired?
He's very, very tired.
Okay.
Very tired.
Is he irritated?
Yes. Irritated and cranky.
Okay. Is he crying a lot?
Yes, he is.
Okay. I just want to take some notes. All right. And you said he's not eating anything at all. Is that right?
That's correct.
Okay. Has he been around anyone that's been sick?
Well, his 3-year-old brother was sick last week.
Okay. And is he still sick now?
No, he's fine now.
Okay. Does Michael go to daycare?
Yes, he does.
Do you know if any of the children at daycare have been sick?
I don't know. I mean, my neighbor's daughter usually goes there too, but she wasn't there the other day, so maybe she's sick or maybe she just took her out. I don't know.
Okay. All right. Are Michael's vaccinations up to date?
I think so.
Okay. Was he a normal 40-week vaginal delivery? Do you know?
I really don't know. I didn't even know my daughter was pregnant until a few weeks before she had the baby, and she just, I don't even know who the father is.
Okay. I'm very sorry to hear about what you're experiencing. You sound very stressed out and anxious.
I'm too old for this.
Okay. I apologize for the circumstances. I'm going to do everything I can today to help you with the situation, okay?
Mm-hmm.
All right. Do you know if Michael is developing normally with his weight and height?
Yeah, I think so. He
Okay.
seems, yep.
Can you tell me when his last checkup was?
A couple of weeks ago.
Was it normal?
I believe so.
Okay. What are his eating habits like? Is he drinking formula or?
His mother drops breast milk off here once a week or so, and then I just feed the rest of his formula. I use it up, and when the breast milk's gone, I fill him up with formula from the rest.
Okay. So he's having breast milk once a week, and the rest of the days he's having formula.
Yeah, pretty much.
Is he eating baby food at all?
Yes, he eats baby food.
Okay. How often is he eating the baby food?
2-3 times a day.
Okay. How is he sleeping? He's having problems with his sleep?
He's really not sleeping very well.
Okay.
He's really not.
And you did say is he taking vitamins?
He's taking vitamins, yeah, the pediatrician gave us some vitamins.
Okay. Has Michael ever been sick before?
Not recently, no, when he was born.
And what happened when he was born?
He had yellow skin.
Okay, I'm sorry to hear that. Has Michael ever had surgery?
No.
Okay. Is he allergic to any medications?
Not that I'm aware of.
Okay. Miss Black, based on the information you've given me, I think that Michael may, the fever may be from a respiratory infection or an ear infection. It could be from a virus or a bacteria. I would like to see the baby so that I can determine the cause of his fever and make sure it's not due to anything more serious like meningitis. I would also need to do a detailed physical exam and some blood tests. Will you be able to bring him in today?
Yeah, I can get my neighbor to drive me down.
Okay, great. We're gonna run these tests and we're gonna try to find out what's causing the fever as soon as we see you. Do you have any other questions for me?
No, not at the moment.
It was nice to speak with you and I look forward to seeing you.
Okay.
Okay, thank you.
Bye-bye.
Bye.